Hello, my name is Greg. I'm a student nurse. Can I get your name and date of birth?
94th of
94, and I will check her wristband. If it checks out, I'm going to go ahead and tell you we're going to do a head-to-toe assessment, and I can ask any kind of history about have you had any surgeries recently or injuries, any kind of issues that have been a general change in your health status. No? Okay. So the first thing I want to do is I want to take her vitals. So I can take her blood pressure, her heart rate, her respiratory rate, pulse ox. I would ask her if she's had any pain and put it on a scale of 1 to 10. Have you had any pain? Okay. And after I get the vitals, I want to ask her a few questions to check her level of consciousness. So I can ask her questions like, where are you right now? All right, and what's today?
It's the 20th of November.
Okay, and then I can ask her also what holiday is coming up.
Thanksgiving.
Okay, so she's obviously conscious and aware of where she's at, what the date is, and what's going on. After I do that, I can check her eyes. We're going to check the pupils for being round, reactive to light. Equal, round, reactive to light, and make sure that they accommodate when there is light. So I'll get my flashlight here, and we'll just bring it into side, gently come down, and check for pupils restricting, and then I can do it on the other side. And I just want to make sure and look at the other eye, make sure the other one's kind of slightly constricting or following, make sure they're equal. So that looks fine. After we do that, I can check her ears, eyes, throat, nose, so I can check her nostrils and make sure there's no deviations or obstructions. Check each of her ears for the same thing. Have you had any hearing issues lately? Okay. Can you swallow for me? Okay, so everything looks right with her swallowing, it looks even. And then can you open your mouth and say ah? Okay. After that's done, I want to go ahead and put on some gloves so I can do some palpation on her neck. The purpose of that is to feel for any kind of swollen lymph nodes. You can also check her thyroid that way as well. So I want to start behind her ears and just kind of lightly feel underneath her jaw, go down on each side of her trachea and esophagus, and then feel along her clavicles. Feel anything, and then to check her thyroid, go around back, tilt your head to the right. I can feel the inside aspect of her neck, don't feel anything. So her thyroid is not swollen or anything like that. Alright. Now, after we've done that, I've kind of already been watching, but we can watch her chest rise and fall to check her respirations. You want to be between 12 and 20 breaths a minute. We also, when I checked her thyroid, I was kind of watching her back, making sure everything is kind of expanding and falling into place evenly, making sure she's not like accommodating for any kind of pain or anything when she's breathing. After we've done that, I want to check her heart sounds. Actually, I'm going to listen for her lung sounds first. Alright, so I'm going to ask you to take a deep breath each time I have the stethoscope to your skin, and I'm just going to glide it over, check each side bilaterally, and then if you feel like you're getting out of breath, you can pause, and we'll just try to keep the breath slow. Alright, so deep breath. Check the opposite side. I'll move in, down, like along each side of her sternum. And then we're going to move, once we do a side, we can move across, go down, across, and that kind of pattern. We'll also do this on the back side. And we'll do the same thing. We're going to follow kind of the outer aspect along her spine and kind of move our way out when we go towards the hip. That way we're checking each lobe of the lung, and we're listening for wheezes, crackles, anything like that would be abnormal. And we'll just say I went through the rest of the motions. Everything sounds good. Then we're going to want to listen to her heart and feel all the pulses. So we kind of want to check the pulses bilaterally as well. We can check her brachial pulses, her radial pulses, her apical pulse, which is between the 4th and 5th intercostal midclavicular line, just below the nipple, and then we can also check the popliteal pulses, the dorsus pedalis, or dorsus pedis, and the posterior tibial. Once we've done that, we want to make sure we also take the heart as well. We want to listen to the pulmonary, the aortic, the pulmonary, Erb's point, the tricuspid, and then the mitral also is known as the apical pulse, and that's the point of maximum impulse. We're going to listen for the S1, S2. If we hear S3 or S4, that's usually an abnormal sign. After we have auscultated heart sounds, I can ask her to lie down, and we'll check her abdomen. When we do this, I want to ask if she's had, when her last bowel movement was? Yesterday. And then have you had any inconsistencies with her stool, other than loose or constipation or anything like that? Okay. Before we palpate, we want to listen because that can move things around. What we're listening for is gurgles, which are the normal sounds of peristalsis. And we want to start at the lower right abdomen and move in a clockwise motion. So we're going to go from the lower right to the upper right, to the upper left, and then to the lower right, and kind of follow the colon around there. What we're going to listen for also is 5 to 30 sounds a minute. So I'll start here, I'll move my way up, go across, and back down. And then in that same order, we're going to also palpate, and we're going to feel for like rigidity, tenderness, any kind of like pain she might feel, or any kind of distended organs or anything like that. So we can also do from a light to a deep palpation to help feel for deeper pain and stuff like that. So once we've done that, I can sit back up. We're going to do some range of motion exercises. So I can have you stand up. And so we'll do the basic flexion, extension, which she's already doing for me, abduction, adduction. You can do it with the knees as well, flexion, and extension on both the legs, and also supination and pronation. Okay, and then another, just a general test we can do to see her gait, and we're already looking at her posture, looks like it's fine. To check her posture further, we can have her face the opposite way and kind of bend over, check the curvature of the spine, and then we can also have her do the up and go test. So you'll sit in the armchair, and then she'll walk 10 feet, and then 10 feet back and sit down, and we'll see if she's able to do it with under 12 seconds. And that way we can also look at her gait and make sure she doesn't have anything with the way she's ambulating. So go ahead. Alright, she did that in about 8 or 9 seconds, so that's good. Okay, so after we've done that, I can't remember, so we'll pause it right there.